start off with just taking a look inside your ear, okay?
Okay.
So, I already have the piece on here. Just going to turn your head. Just like that. Great. Great. So let's take a look inside. So, just going to inspect the outside first. So, okay. Just looking for any signs of infection or any clogged pores or anything like that. I don't see anything of concern. I'm just going to go inside. Just pulling the top of your ear. Just let me know if you feel any discomfort, okay?
Okay.
And I'm going to go a little bit deeper. So far the canal looks really good. There's a bit of cerumen, but it's quite healthy yellow color. And I'm just going to visualize the tympanic membrane. It does look a little bit white, so slightly opaque, but I'm still able to very clearly see the cone of light and the bony landmarks. There's a little bit of vascularity, which I think is normal. Is that uncomfortable at all? Or is that okay?
No, feels fine.
Okay, I'm just going to go in one more time. I don't see any signs of infection. And the ear canal looks a nice flesh color. Yeah, so no contraindications on this side for the ear candling, so that's good. Great. Let's take a look on the other side. Again, we're going to start with inspecting the external ear. The skin looks very healthy. Great. Now clean. We'll do a little bit of cleaning before the ear candling. So I'm just going to pull the pin out of your ear and work my way in a little bit. And again, just a little bit of cerumen. It's a nice yellow color. And then ear canal is also not red. That's good. Okay, I can see the cone of light. There's no signs of bulging of the tympanic membrane, no perforations, bony landmarks are present. And it's a nice translucent membrane, so that's good. This ear looks very healthy, and again, no contraindications for the ear candling procedure. Great. Thank you. You're welcome. Right. So, I do want to do a little bit of cleaning. So I'm just going to move your head again. And I'm going to use this little cotton pad and apply a little bit of hydrogen peroxide. There we go. Just gonna put on a pair of these gloves. And just gently wiping the external ear. Good. There we go. Nice and clean. Right. And clean. Very good. So while we wait for the results of the allergy test, I'll do some exams of your head. I want to start by just examining your face and your head. Pain here? Press down.
There.
What about here?
No.
What about up there?
No.
Okay. What about here?
Yeah, that's the one.
Down here?
A little bit there too, yeah.
Alright.
Not there.
Okay. Okay, there's no lesions. There's no signs of trauma.
Okay.
Let's look back here. No lesions on the ears. Mastoid process seems healthy as well. No signs of infection. Okay. I'm just going to kind of squeeze a little bit all over your head here. Let me know if you feel any pain.
Okay, no pain.
What about back here?
No pain.
Long neck. Over here.
No pain.
closer at your eyes. Just look straight ahead. Oh, sorry. There you go. Thank you. Okay, just open up your eyes. Take a look. It does look like your conjunctiva is a bit inflamed, and you do have some watery discharge on that side. Okay. Let's look over here as well. Yeah, same thing over here. Okay. Okay. And then I'm just going to do some percussion. Okay. Any pain there?
No.
Any pain?
No.
Okay. And that?
Yes.
The facial pain that you were feeling?
Yeah.
And over here.
Yeah, same as the other side.
Okay. What about here?
Mm-hmm. That's right.
Okay. And there as well?
Yeah.
Okay. Let me also palpate your lymph nodes.
Okay.
So again, let me know if you feel any tenderness or pain.
Okay.
Start back here.
None.
I'm also trying to notice if I feel any enlarged lymph nodes, which I don't.
Okay. No pain.
Good. Also check around your ear. Have you noticed any issues with your ears?
No.
Okay, any feelings of congestion or
Not
trouble hearing?
Not in my ears.
Okay, good.
No pain.
Just gonna move your head slightly like that.
Okay.
Okay. Can you shrug up your shoulders? Okay, release them. Okay. Alright, no issues with your lymph nodes.
Okay, great.
Okay, so do you want to check your vision?
Okay.
So I want you to cover one of your eyes. Okay. Let me know which line you can see clearly, like which lowest line you can see clearly. Is it this bottom line here?
No, not quite. The one above it, though.
The one above it? Okay.
Yeah.
Go ahead and read it from left to right.
9, 3, 7, 8, 2, 6.
Great. You want to try the bottom one?
Sure. 4, 2, 8, 7, 3, 8. How'd I do?
You did well. well, actually.
Really? Okay.
Good job.
Thank you.
So let's switch eyes. Okay. And if you could please read that same line but backwards.
Okay. 9, 3, 7, 8, 2, 4.
Wonderful.
Oh,
so 20/20 vision both eyes.
My contacts are working.
Good. So it seems like the watery eyes isn't really bothering your vision so much.
Okay, good.
Yeah. Is that what you've noticed as well for yourself?
Yeah, they do feel kind of painful, itchy, distracting sometimes, but not affecting my vision.
Have you noticed that it does get worse after you swim or like during swimming?
It does seem like that.
Okay. Okay, good to know.
Yeah.
And then now I'm going to check your ears.
Okay.
Okay. Let's start with this one over here.
Okay.
Let me know if you feel pain or discomfort. I can always change my technique.
Okay.
Okay. So the cone of light is present. The interior lower quadrant along bony landmarks are present. Don't see any erythema. Don't see any discharge behind the tympanic membrane, bulging. The canal seems clear as well. Okay, great. And is there any pain when I do this?
No, no pain at all.
And was there any pain when I pulled on the top here?
Nope.
Okay, so there's no sign of infection in that ear.
Okay.
So let's check this ear now.
Okay.
Okay, also the cone of light is present at the interior lower quadrant. There's a little bit more redness over here. Kind of the vasculature of the on top of the tympanic membrane is a little red. But other than that, it looks perfectly healthy. No signs of cloudiness behind the membrane or any issues there. Okay. Have you ever had any issues with this ear before?
No, actually.
Okay. Well, I'm not concerned
Okay.
with any of those ears, and the fact that you don't have any symptoms either is a good sign.
Okay. Thank you.
Nice. Okay. Julia, now we're going to take a look at your nose.
Okay.
So, please don't mind me. Just going to get inside. I'll try not to go too. Okay, thanks. I do see kind of pale, boggy turbinates, and it does seem quite inflamed in there. A bit swollen. I don't see any ulcers or polyps, which is good, or any like signs of damage in there. Okay, I can trauma.
Okay.
So that's good. Let's take a look on this side. It's a little harder to visualize over here. Okay. I would say equally inflamed and swollen on this side,
Okay.
as well as the pale and bogginess that I described earlier.
Okay.
Okay, good. Was that uncomfortable for you?
It was fine.
Okay. I'm just gonna write down some notes about the ears and the nose. Okay, good. All right, Julia. Now I'm going to do what's called sinus transillumination.
Okay.
So we're going to see if your sinuses are in fact congested. So let's start with the frontal sinuses, and if you can see this nice glow, then it means they're clear. That's good. I'll check the other side. Perfect. Okay. Now I'm going to have you open up your mouth so I can see the top of the roof of your mouth. And we're going to check in here as well. Okay. So I'm having trouble visualizing the light through that particular sinus, the maxillary sinus. So let me try this side here. Yeah, I can't quite visualize the light on that side either. So it does look like you have sinusitis and congested sinuses.
Okay.
And it is likely due to allergies, but I'm going to continue by looking at your throat for some more confirmation or ruling out other pathologies, perhaps. Okay. Can you open up your mouth? Good. And say ah. Okay, great. So your tonsils are not enlarged. That's really good. I do see a bit of this kind of cobblestoning effect to the back of your throat, the back of the pharynx. That can suggest postnasal drip. I see kind of this clear mucus at the back as well. It's a little thick. Okay. Now I do want to kind of tap your teeth, so just tap it here. Let me know if you feel any pain.
Okay. Yeah. Yeah, it's kind of painful.
Yeah? Is it that same? How do you describe it?
Kind of achy. Yeah.
Okay. And what about down here?
No pain.
Okay. And I want to take a more thorough look at your teeth, just to make sure I'm not missing any issues. Take a look at your gums as well, and I want to see if there's any signs of infection. It looks very healthy. You're doing a great job with your dental hygiene.
Great.
Look here. And then just open up your mouth a bit more. Great. Can I also take a look at your tongue? Okay. Okay, move it to the side over there. Okay, other side. Then touch the roof of your mouth. Great. Looks good.
Okay.
Start with, I'm going to be testing the sensation of your cranial nerve 5.
Okay.
So that just means I'm going to test your light touch and pain sensation.
Okay.
So light touch will feel like this. You feel that?
Mm-hmm.
And pain will feel like this. Can you feel that?
Mm-hmm.
Okay, good. Alright, so please close your eyes. This is the instruction. You're going to go ahead and let me know if you're feeling the brush or the point.
Okay.
And you're going to point to the location of where you feel that sensation, okay?
Okay.
So let's get started. I'm just going to brush your hair back a little bit. Okay. So we just feel all of your face.
So that's the brush. Point. Brush. Point. Point.
It's okay.
Brush. Point. 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 Brush. Brush. Point. Brush. Point.
Okay, great.
Did I get them all?
Yeah.
Okay.
So I don't suspect any issues with cranial nerve 5, which is the trigeminal nerve.
Okay.
And so there's no nerve issues that I suspect there.
Great.
That's good. So now I do want to check your cranial nerve 1, which is your olfactory nerve. It's your sense of smell, basically. You said you were having a reduced sense of smell, yes?
I am, yeah.
Okay, so do your best to smell these 3 scents that I bring.
Okay.
I want you to close your eyes, though, so that you don't cheat.
Okay. I'll try.
Okay, so let me know what you smell.
Vinegar.
Good.
Honey.
Mm-hmm. Great. So you got them all right.
Oh, good.
So that's good that you still have, it definitely shows that your cranial nerve is intact.
Okay.
But are you able to still enjoy food and, eat?
When my
reasonably?
when my nose is congested, I can't smell or taste food very well.
Mm.
When it clears up, so it kind of oscillates throughout the day and night.
Okay.
So when it clears up, I'm fine.
Okay, and
Yeah.
right now it's quite clear for you?
Yeah.
Okay, I hear you.
Yeah.
Yeah, I just want to make sure you're not, that you're eating enough and you're being fed. Like, as a student, you're using up a lot of your energy, so
Thank you.
got to make sure you're well fed.
Yeah.
Okay, good. All right, Julia, so now we can check the results of your allergy skin test, so I'll just have you get back on the table facing down.
Okay, thank you.
All right, Julia, so first we want to do some range of motion of your spine. So
Okay.
I'll just gently guide you along and see how far each part of your spine can move and whether it's symmetrical in its movement.
Okay.
So we'll start with just bending forward all the way. Okay. Let me know if you feel any pain or tenderness anywhere when we're doing this.
Okay.
How is that?
That's good. No
Okay.
pain.
Over here on the left. And then we're just going to rotate. Alright, the other way. Okay. And now I'm just going to have you relax. I'm going to move your neck for you.
Okay.
Okay. So I'll just move it. And I'll just be supporting you as we do this. Okay. See how far we can go there. Okay, any pain on movement?
No, actually.
No? Okay. All right. So now let's check your thoracic spine.
Okay.
So I'm actually going to have you just kind of bend your spine forward.
Okay.
As far as you can go, kind of curving the upper back as you go down. Okay, and back up as far as you can go, backwards. Okay, it's very flexible. And then over here, you're going to bend sideways. Okay, and then on the other side. Okay, great. I'm going to have you actually get onto the massage table here.
Okay, on my back or?
Sort of bend, kneeling on your legs, like your knees.
Okay.
Facing that way.
This way?
Mm-hmm. I'm going to have you sit on your heels.
Okay.
And your hands, palms flat. And then I want you to again curve your upper back upwards towards the sky. Okay, and then back down as far as you go. We're just isolating the thoracic spine.
Okay.
Okay, that looks really good. Now I'm going to have you put this hand up here and then twist your torso so that your elbow goes all the way up as far as you can go. Great. And then the other side.
Okay.
Okay, good. Doesn't look like there's any global restrictions here.
Okay.
Now we're going to check your lumbar spine. So I would like for you to stand up. Right. Now I'd like you to bend forward as far as you can go.
Okay.
Touching your toes if you can. Okay. Amazing. Now come back up. Any pain when you did that?
No.
Okay, now just bend backwards. I'll be supporting your back as you go. Okay, wonderful. Any pain with that?
No.
Okay, now to the side. Okay, good. Other side. Can we try the left side again?
The right side or the left side?
The left side. Let's try that again. Okay, and the right side. Okay, great. Okay, I'm going to stabilize your hips and I want you to just turn your torso towards the left as far as you can go without moving your hips.
Okay.
Okay, other side. Okay, one more time on the left.
Okay.
Just want to check. And on the right. Okay, great. Thank you so much.
Mm-hmm.
You can go ahead and take a seat.
Okay.
Okay. Julia, so now we're going to do some neurological testing of your upper body and then your lower body.
Okay.
So I'll start off with testing your reflexes. Okay, so I want you to just relax as much as you can. Okay. Okay. Okay, great. Okay, so now I'm going to be testing your dermatomes. I'd like you to close your eyes.
Okay.
And I want you to let me know if the sensation that you feel, which is this sort of sensation, is the same on both sides or different, okay?
Okay.
I'm just gonna have you turn your hands like this. Okay. So we'll start off with same or different?
Same.
Okay. Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Okay, great. So now I'll do your myotones. So we'll start off with C1.
Okay.
So I want you to press into my hand, the one up here. 1, 2, 3, 4, 5. Great. And then back here. 1, 2, 3, 4, 5. To the side. Just press into my hand. Yeah. And then bend to the other side. Okay. 1, 2, 3, 4, 5. Great. Now I want you to push up into my hands with your shoulders. Good. 1, 2, 3, 4, 5. Okay. Now we're going to be testing C4, C5. Okay, so push out. 1, 2, 3, 4, 5. Okay. Now don't let me bring it up. Don't let me move you. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Great. Okay, so don't let me move your thumbs. 1, 2, 3, 4, 5. And I'm going to do this and squeeze my fingers. Don't let me move them out. 1, 2, 3, 4, 5. Great. Okay. So now we'll move on to your lower body.
Okay.
Okay, so a few more reflexes.
Okay.
Good. Oops. There you go. Good. Good. Great. Okay, so now I'm going to do dermatomes again. I want you to again close your eyes, and I'll again ask you whether you feel the same sensation or different on both sides. I'm just going to move your hands over here. Great. Okay. Same or different?
Same.
Okay. Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Okay, great. Alright, so now I'm going to do the myotomes for your lower body.
Okay.
Just brace yourself on the massage table.
Okay.
We're going to test one leg at a time.
Okay.
So we'll start with this leg. I want you to resist. Don't let me push you down. Good. Okay, and then here, don't let me push you. Good. Okay, don't let me move you. Good. And then don't let me move you here. Don't let me move you here. And then don't let me move you here. Okay, good. Let me actually do that again, so I just want to isolate
Okay.
more time. Don't let me move you. Okay. Okay, same thing on the other side. Don't let me move you. Here. And over here. 1, 2, 3, 4, 5. Great. Okay, so that's all your neurological testing. Looks like everything is normal. They're functioning well. So next we're going to be assessing the spine, and then we'll do some adjustments.
Sounds great.
All right, Julia, so I'm gonna go ahead and inspect your shoulders, if that's okay.
Okay, yeah.
Let me just put on these gloves here. Okay. Well, let's just start from back here.
Okay.
And then look at your spine. So it does look a little red and slightly swollen. This side. Okay, it's definitely not swollen here, so that's good. In terms of symmetry, I would say that it's symmetrical on both sides, so I don't suspect any kind of dislocation. Good. So look over here at your clavicles, and okay, so they're not too high, so I don't suspect a corticoclavicular injury. Alright. I don't see any scars. I don't see any signs of open wounds. Let me just take a look at your arm as well. Have you noticed anything different with the skin on your arm?
No, I haven't.
Okay. Let me just look at any changes in color. Any signs of muscular atrophy, which I don't see. Okay. Alright, so I'm just going to start by palpating the humerus here. Any pain when I do this?
That is pretty painful.
That is painful, okay. Yeah, so that's the greater tubercle back there where the various rotator cuff muscles attach onto. Any pain over here?
No.
Okay. And what about here? This is the coracoid process.
Mm-mm.
And along the clavicle.
No.
Okay. Following along the acromion, going back here to the spine of the scapula. Any pain here?
That is kind of painful.
Okay. Along the medial border of the scapula and the inferior border. Okay. Let's go down the arm. And just going to feel along the humerus. Okay, I'm just going to hold that up a little bit. Epicondyles of the elbow and the olecranon. Just let me know if there's any pain or tenderness.
No
Okay?
pain.
Along the forearm here. Anything here at the wrist?
No pain.
Okay, good. Along the hand?
Mm-mm.
Okay. Alright. Just make a few notes here.
Okay.
All right. So in terms of the pain, you said it starts around here, right? And does it radiate at all?
It does radiate a little bit up here.
Okay. And does it radiate down at all?
No.
No?
Well, maybe a little bit down here, but not all the way down there.
Okay. That's good. So. Okay. And are you able to lie on your shoulder when you sleep?
No.
Not at all? Okay. Are there any activities, daily activities that you aren't able to do? For example, removing a shirt or putting on a shirt, or eating anything at all that you can't do?
I can't. Yeah, I guess I have been using my right arm heavily to do things like putting on clothes, reaching things from my cabinets.
Okay, got it. Okay. Okay. So, Julia, now I'm going to just palpate some of the soft tissues here.
Okay.
So I'm actually going to be taking your arm and just kind of extending it back. So I want you to just relax into my hand there.
Okay.
That'll sort of help me. Any pain here?
That is... that's a little painful, but not like the most intense pain.
Okay.
No pain there.
No pain there? Okay. It's along the deltoid, nothing there?
No.
Okay. So what about this muscle here?
That's
painful?
Yes.
Okay. And what about this one here?
No,
No?
that's okay.
Okay. And then what about here?
Nope, that's fine too.
Okay. And the front here, the pectoralis?
That's fine.
Alright. What about right here?
No pain.
And here?
No pain.
Over here?
Yeah, no pain.
Okay. Okay, let me just double check. Any pain here?
No.
Okay. So, occipital tendon. Non-painful. Okay. Okay, so I'm going to be testing your dermatomes. I want you to close your eyes and let me know if you feel the same sensation on both sides or different.
Okay.
Just close your eyes.
Same.
Okay.
Same. Same. Same.
Okay. C5, T1. Then we'll just do.
Same. Same.
Okay.
Same.
Move that a little bit.
Same.
Okay, good. So no issues with your dermatomes.
Good.
Alright, so now I'm going to be doing testing your myotomes. I want you to just face forward and then push into my hand. Good. 1, 2, 3, 4, 5. Okay, good strength. And backwards into my hand. 1, 2, 3, 4, 5. Okay, and sideways into my hand. 1, 2, 3, 4, 5. Good. Other side. 1, 2, 3, 4, 5. Now shrug up into my hands. 1, 2, 3, 4, 5. Great. Okay. So this might be a little painful. I'll start from this side.
Okay.
So push into my hand here. 1, 2, 3, 4, 5. Okay, let's see if you're able to do this, okay? Push in. Not
Can't
really. Okay.
Yeah.
Alright. And then we're just going to turn. Push up into my hand. 1, 2, 3, 4, 5. Okay. Push down. 2, 3, 4, 5. Other side. Okay. Push. 1, 2, 3, 4, 5. And down. 2, 3, 4, 5. Good. Okay, a few more.
Okay.
Take your hands. I want you to kind of push up into my hand with your thumb there. 1, 2, 3, 4, 5. Other one. So kind of like this. So like that.
Oh,
Yeah.
I see.
1, 2. Let's try this. 1, 2, 3, 4, 5. Good. Now I'm going to be placing my fingers between yours.
Okay.
And I'm going to try to pull my fingers up and try to stop me from doing that. So
Okay.
squeeze as hard as you can. 1, 2, 3, 4, 5. Okay. 1. 1, 2, 3, 4, 5. Okay. And this way I'm going to have you resist against my fingers
Okay.
as well. So try to like
Spread them.
spread them, exactly. 1, 2, 3, 4, 5. And this one here. Okay, try to spread 1, 2, 3, 4, 5. Okay, great. So no issues with your myotomes except for right here. So
Okay.
that is C1, C2, C3, 4, C5 on the left side.
Okay.
Just gonna make a note of that.
Okay.
Okay. All right, now we're going to be performing active range of motion with your shoulder.
Okay.
So I want you to start off with bringing your arms up like that as far as you can go. As far as you can go. Any pain there?
No.
Okay, bring it back down. Okay, and now backwards like this. As far as you can go. Any pain there?
No.
Okay. Back down. I'm going to have you do this kind of motion.
Okay.
Mm-hmm. Yeah, go ahead. Any pain there?
No, no pain.
So that's as far as, okay.
Oh,
Good. Yeah, so just go as far as you can in your range of motion. Okay, good. Now I want you to turn this way and bring your hand as far. Oh, you're very flexible. Okay, great. So that's internal rotation.
Okay.
The other one as well. As far as you can go up. Good. Okay, there's a little bit of winging there. Can I just see that again?
Yeah.
Going up. Just a little bit of winging there.
Just on the right side?
On the right side. Can you see this left side again? Yeah, there is a bit there as well, but I think it's more prominent on your right side. Okay, so now we're going to do the abduction. Just go as far as you can, alright?
Okay.
So don't, we're going to go up like this.
Okay.
Just as far as you can.
Okay, I can't more on the left.
Okay.
I can go all the way on the right.
Is it painful when you do this?
Yeah.
Okay, bring it back down. So that was about 40 degrees. Range of motion. Abduction on the left arm. Okay. So now we'll do passive range of motion.
Okay.
So I don't want you to do anything. Let me move it for you. Okay. Where do I stop? So again, you don't have to do anything.
Okay.
And I'm just going to put it as far as it can go. Okay. Okay. Alright, and then I'm just gonna release. Don't use any of your muscles. You're gonna see if I can go with this. Okay,
That's fine.
that's fine.
Yeah.
Alright. Okay, go ahead and do the same thing on this side. Okay. Very good. Nice. Okay. Rotate. Okay. And then again, abduction. Okay, you're fine.
Yeah.
So with the resisted range of motion, you didn't have any pain or any issues with abduction. So like going up like this, but with active range of motion there was. So that does suggest that there's contractile tissue, muscle, and tendons that are at play here with your injury. Specifically, I am suspecting rotator cuff tear with the supraspinatus muscle because you had trouble abducting, but you didn't have any trouble with external rotation as well as internal rotation. I do want to do a few more tests to confirm my findings, if that's okay.
Okay, yeah, of course.
All right. So the first test, if you could just turn to face me. So we're going to start off with the empty can test.
Okay.
And I want you to just bring your arms forward like this. And just that way. And just turn it down like this. Good. I'm going to be pushing down.
Okay.
And you're going to try to resist and keep your arms up, okay?
Okay. I can't on that.
Can't on that one? Okay, you can release.
Okay.
So that's a positive finding on this arm for the empty can test,
Okay.
which suggests some sort of rotator cuff impingement.
Okay.
So now I'm going to be doing the internal test.
Okay.
Just hold your elbows like that. I'm going to be pushing your elbows in and you're going to try to resist again, okay?
Okay.
Okay, good. So I don't suspect any issues with the teres minor and the infraspinatus.
Okay.
Now I'm going to be doing Jurgensen's test. So I'm just going to test your bicipital tendon one more time.
Okay.
So here, I'm just going to hold on, try to find your bicipital groove here. There we go. And you're going to try to turn a doorknob while also moving your arm out like this. And I'm going to be resisting you, okay? So, okay, good. So, I didn't feel the bicipital tendon pop out or anything like that, and it doesn't seem like you were in pain at all.
Yeah, that was fine.
I don't suspect bicipital tendinitis.
Okay, great.
Okay, and for this test, I want you to bring your arm back like this.
Okay.
And you're going to try to lift your hand off of your back towards me. Okay, good. All right. So I don't suspect any issues with your subscapularis muscle as well.
Good.
So Julia, I'm going to get started on your deep tendon reflexes.
Okay.
So I just want you to relax your leg as much as you can. I'm just going to tap. Okay. So that's a nice 2+ normal response.
Okay.
And then I'm going to go onto your affected knee. Again. Okay. Did that hurt when I did that?
No.
Okay. And then I'm just going to check your other reflexes.
Okay.
So, actually just going to dorsiflex and good. That would be maybe a bit more like a 3+. Good. Perfect. Okay. And then I also want to check your myotones, so your muscle function here. I'm just going to have you resist against me, so just push up into my hands. Perfect. Good. And then push in. Yep. Good. And then your feet up against and your toes. Good. And downwards. Great. So all of your muscle function is normal.
Okay.
So now I'm going to be doing some inspections.
Okay.
So I'm just going to check. So we'll actually start on this side. And just let me know if you feel any pain or tenderness anywhere that I'm touching.
Okay, none on that side.
Okay. And I just want you to relax. Okay. Okay. Good. I don't see any visible swelling or redness, so that's good. And then I'm just going to check your calves for any like rashes, any lesions, any wounds, which I don't see. Okay. Good. I'm just also going to check your thighs. Okay. Let me check over here as well. Okay. Just relax again. Is that painful at all?
No.
No. What about that?
No.
Okay. And this?
No.
Okay. I don't feel any fluid.
Okay.
And it's not warm to the touch either, so that's good. Just gonna check down here as well. Okay, so I'm just gonna have you raise your thighs up.
Okay. Okay, how high?
That's good. And then back down. Good. And then now can you rotate your legs in this way?
Both of them?
Yeah, you can do both of them and then back out. Good. Okay. Did that cause any pain when you were doing that? No? Okay, good. Now I'm going to have you work on the knee joint. Okay. So if you can just flex. Yeah. And then just keep this part the same and then just exactly extend and bring it back down. Good. Okay. Other one. Good. Okay, perfect. So that all looks normal. And now I just want you to flex your foot upwards and down, and then internally, yeah, other way, good. And then if you can just do like this way. Like turning it, yeah, perfect. Okay, good. Other one, so then flex up and down, and then in this way, good, and then out the other way. Very good. Okay, perfect. Okay. So now we're gonna go ahead and do some knee examinations. Okay. So first I wanna make sure to check for any effusion. So I'm just gonna be doing a balloon inspection first and just checking to see if there's any fluid, which I don't see. Okay. And then I'm going to be just tapping on the patella. Perfect. So that's just bouncing up really nicely, so that's good. And then finally, I'm going to be just sort of moving the fluid to the lateral side. And then tapping and seeing if there's a bulge, which there is not. Okay. I'm gonna do the same thing over here. Okay. Any pain?
No.
Okay. And then again, just moving the fluid out of here. Okay. No effusion. That's good. And then I'm going to do a couple of knee exams this way. Okay, so I'm just going to be checking your anterior and posterior collateral ligaments. So I'm going to start with your unaffected knee. I'm just kind of sitting on it to support and keep it stabilized. Pulling it forward, pushing it back. Okay, so that is negative for both of those signs. That's good. Okay. And we'll work on your affected knee. Just pulling forward, seeing if it gives way, which it does not. Perfect. Okay. Next, I'm going to do the McMurray test. So for this test, I'm actually going to be just flexing your knee up like this. And we're going to check first for the medial meniscus. And I'm just going to be internally rotating here slightly and then externally, and then extending. Okay. So that medial meniscus is intact. I might as well do the lateral meniscus while I'm here. So again, this time it's the opposite action. Just gonna go out this way, internally rotate down here, and extend. Okay. Lateral meniscus is also intact on the right knee. Same thing over here. So that pull, good. Other way. Pull. Okay. So for this one, I'm going to flex 30 degrees, and then that's valgus, which is negative, and then Mars. Okay. Here's something. Valgus. And Mars. Okay. So both of those signs were negative on both knees as well. So Julia, we're going to be doing a few walking routines, and I'm just going to be checking for any imbalances in your gait. So if you can just walk from here down to that door and then back. Just normally at first. Okay, let's come back. And one more time.
Okay.
Okay, so was your knee bothering you at all while you were walking just now?
No,
Not
it's
so
usually
much.
after a lot more activity.
Okay,
Yeah.
walk on your tiptoes.
Okay.
Go ahead. And does that bother you at all?
No.
Okay. Good. And then heel to toe. So like this.
Okay.
Yeah, same thing. Perfect. Looks like you're balancing really well and not compensating in any way with the pelvis drop.
Okay.
And there's no limp either, so perfect.